Right, welcome back to Morning Live on SABC2 and SABC News Channel 404. We cross live to a reporter in Mahikeng, Bokonebo. She's attending the last day of the first ever health and social development show that is hosted by the Bokonebo province. The Expo started on Monday and it's been showcasing career exhibitions, business networks, villages and townships initiatives that the provincial government has. Let us say hello to her. She's joined by the MEC of Health. She is Olebogeng Kgosilentswe. Olebogeng, good morning to you.
Good morning, Palisa, and welcome to the Mabatu Convention Center. I'm joined here by the MEC for Health, Dr. Mahikeng, and we're going to be chatting a bit about the objectives of this event, among other things. Good morning, MEC, and welcome to Morning Live. Just before we get into it, I'd like to talk about the passion for health care professions. Where is it? Is it still there at all?
We are trying to make sure that it's there all the time. We are aware that in some cases it's not there. What we are doing here today is that it's not all about money. That South Africa was built on building blocks of that of the fact that South Africa belongs to all who live in it, black and white. And so some tracks, some work is one of the concretes that were exposed by our Premier. And that whatever we do, we must show the people of the Northwest that we can work together. That's the first. Secondly is to make sure that everything that we do must be channeled towards villages, townships and small dorpies. So rural people are here, white people are here, stakeholders are here, business people are here, everybody's here.
You talk about rural people. I'd like to talk about the poorest of the poor, the vulnerable and needy. How are they really benefiting from this expo?
The rural people are benefiting from this expo because technology is taken to the people out there. I can tell you now that there's a digital X-ray in a place called Khanyesa. That's high advanced technology. And the companies that are here are selling products that we believe will reach the poorest of the poor in those villages, in those townships, in those small dorpies.
One important factor that I'd like to discuss with you, MEC, is the state and the quality of psychiatric health care in the province. Take me through that a bit.
We are building a 384-bed hospital in Mahikeng as we speak, the pt1 hospital. It's an advanced hospital. As you enter Mahikeng, it's one of those things that welcome you into Mahikeng. It's a beautiful hospital, and we hope before the end of this year we'll be able to open the whole facility. We've got 116 beds in what we call Veteran Hospital in Potchefstroom. We've got 60 beds in JST in Rustenburg. We have 20 beds in Taung. So it's all covered, and we are directly in charge. It's not outsourced. We are doing it ourselves. However, we also believe that primary health care must take an active role in psychiatric treatment. So most of the patients who are discharged are put in a process where the community and the family gets involved to understand psychiatric treatment so that the patient is integrated back to society and takes treatment in the local clinic.
Now, there are countless private sector organizations here. We've seen about 200 exhibitors. Briefly tell us about their contribution really generally to the health sector of the province.
They understand our problems better. They are going to contribute better because yesterday we had a meeting between the private sector and ourselves and communities. And a lot of things came out. I can tell you now, I was very impressed with a community member who said we must actually have dietitians in clinics if you are serious about non-communicable diseases. Now, that's a first. This is a member of the community who says, if we are going to make sure that our people eat well, we must also teach them about eating well in clinics, not only in hospitals. That's a good one. The private sector has contributed a lot. I can tell you now, we now have a relationship with Netcare in Rustenburg, where the first cardiac operation was done in the Northwest province, in the history of this province. It is because of a 6-year program and discussion that we've had with Netcare to make sure that even the poorest of the poor access the best clinical care and operations, cardiac operations in the Northwest. And we think it will work for all of us.
And just briefly, before we let you go, would you say that you have achieved your objective through the past couple of days, including today?
The participation of the private sector, the participation of communities, the participation of students, and the participation of all of us makes me realize that, yes, we have achieved our objective.
Thank you so much, MEC. That was Dr. Mahome Masike Palisa, the MEC for Health in the province, talking to us about the objectives that they intended when they first spoke about this Social Development and Health Expo. Now, there are quite a lot of exhibitors, as I've mentioned before, and I'll be talking to one or two of them as the program progresses throughout the day. Palisa.
Olebogeng, that's our reporter live from Mahikeng in the Northwest Province, talking to us about the exhibitions involving the Department of Health and the Social Development. Like she said, we are going to be crossing back to her for the latest happening.